Hi, it's Michelle from Movement Lesson. Had a great question about someone who just had a swallow study and they wanted to place an NG tube and they wanted to ask me. Now, first of all, for the most part, guys, I haven't worked with your child. Facebook is a great tool for resources and it's great to get a second opinion. When it comes to something as medically complex as that, you need to work with your professionals who you're working with. Your doctor is a first round course. However, I'm here to help you at least understand what possibly is going on. Usually what happens after a swallow study is that if they see aspiration, meaning that they're seeing fluids going into the lungs, they'll start usually with the thinnest liquid, water, what they do is they taint everything with barium. Yes, barium. And so the radiation shows up on the swallow study. So they'll start with water. A lot of kiddos just penetrate, meaning that it just sort of hits into the airways, but it doesn't aspirate, it doesn't go into the airways. When you have penetration, sometimes what they'll do is they'll suggest a liquid thickener, right? There's anywhere from nectar-based to honey-based to really, thick liquids. Yes, it's not always appealing to be adding this, but at the same time, it keeps your child eating, usually and drinking by mouth. If there is aspiration always risks pneumonia. It risks infection. It risks fungal infection. It risks, you're bringing in bacteria, which shouldn't be, lungs are there for breathing, not for anything from that. Vomiting can cause aspiration. It's one of the biggest complications with sleep apnea. People think sleep apnea is about falling asleep, but what it is you get an obstructive airway. So your airs are now, well, that suction is actually pulling acids out of your stomach and into the lungs, right? That's how bad it can get. So if you have COPD or you're supposed to be using, a CPAP or BiPAP or one of those or HPAPs, and you're not using it and you're going into those things and you're having pneumonia once or twice a year, that's what it's from, because you're aspirating, right? We can aspirate something stupid as taking a pill. If you've ever gone to eat and chew and talk, and most likely you've aspirated. We all do it, but it's doing it on a consistent basis. That's where there's a problem. And if they find that your child is consistently aspirating, then yes, they might suggest an NG tube, which is a nasal gastric tube. It is what it is. It goes up through the nose and then down through back of the throat and down into the esophagus. They place it. Usually it drips right above the stomach. They can attach all the way down into the intestines it's called an NJ tube, right? Where it bypasses the stomach. Depending on where your child's complications might be or your complications might be. Then what is going on with that is they'll usually try that, see if the child can get better head control, better awareness, whatever is their reasoning, and then they'll do a second swallow study. I've seen kids literally hospitalized at the swallow study saying you're getting a G tube, right? It's just when they feel that the aspiration is going to put the child's life at risk, that might be a conversation you're having. Now, a lot of countries, a G tube is a gastric tube right to the stomach. It's a button that goes right in. A lot of countries don't believe in G tubes. You know what I mean? They wouldn't even do the swallow studies. The swallow studies are done in European, usually countries, and U.S., Canada, and so forth. You don't see a lot of these done in other places of the world. I've seen babies, and one I worked with who passed, I worked with her at 3 months old. They were just trying to spoon feed her. It just, it is what it is. We don't have the medical equipment, we don't have the medical knowledge, and we don't have that awareness to things. But that's where the beginning conversations would be with your doctor. It is, again, medical intervention. There's questions and answers to be bought. You have to understand one thing too. With a baby, there's a bottle, right? Once a child starts getting older, now you need volume because your child's bigger. Can you sustain the volumes that you're doing, with careful eating? And that's a question. I know personally, my son is now about to be 19. Not getting a G-tube is one of the biggest regrets in my life, because I would have had the opportunity, even though now he does eat, he eats very minimally, and like pizza and chicken, that's it. And I would have had the opportunity even now to put spinach into the tank, that kind of thing. And so those are the things that you look at and have to take into consideration. Your needs of your family, your needs of your child, where they are medically, where they are, can they handle the surgery? There's lots of questions that need to be brought up between you, your doctors, and usually this is a team. They're not ganging up on you. They're there to look at the care of your child. Aspiration is something that needs to be taken seriously, right? Not only because a child's going to be chronically, or can be chronically, ill due to these complications. And it's not something you've planned on, so it's okay that you have time to digest on it, but you need to take care and take it where you need to take care of it. Thanks.